are here today to discuss very important topics. I think Trinidad, she highlighted and about accessible tourism and the medical tourism. Medical tourism is part of accessible tourism. Today, I have expert in this field, Mr. Mohamed, Dr. Rola, Agab. We will have like a round with them just to tell us about their experience and how can we improve this sector, not only in Dubai, in the world. So I would like to welcome you all. I'll start with Mr. Mohamed. Can you brief me a little bit? Dubai spent a lot of time, plan, invest to be one of the best in the world as a medical center, international center. Can you brief me about it?
Bismillah ar-Rahman ar-Rahim. Assalamu alaikum jami'an. Distinguished guests, ladies and gentlemen, I would like to thank Ghassan prior to our panel for inviting me to be part of this esteemed panelists. I do believe that Dubai, if we look at how young the United Arab Emirates as a country is, reaching up to the 51st anniversary, hopefully in a few days' time, we come to a point of understanding that the growth of tourism has been tremendous within the span of the 51 years that we had. Now, I used to be part of Dubai Tourism, and looking at their objectives when it comes to increasing the amount of rooms that we have in the destination, or whether it is increasing the length of stay of people. Dubai is quite flexible and adaptive towards the tourism needs. And it comes to a point of understanding that tourism has a lot of niche markets within, knowing that medical is one of those. If we look at the infrastructure of Dubai, we know for a fact that we are capable enough to assist in providing talents, technology, accessibility to the destination. Dubai today is one of the easiest destinations that you can visit, whether it's through Emirates Airlines or any other airlines that comes through Dubai Airport. Now, that by itself is a miracle because we're located in the middle of the world and we have a cosmopolitan city where we have more than 117 nationalities living within the destination. So there is no language barrier between us nor the patient. There is someone that can assist in translating or a doctor that comes from the same origin in a sense. So I think that would cover it in a nutshell. The infrastructure supports the medical tourism and we strive to promote the talents, the technologies, and the healthcare facilities that we have within the city of Dubai.
Thank you, Mohammed. Dr. Rola, medical tourism without a great hospital, great doctors, it will not work. Can you brief us a little bit about how your journey with this field, please?
Thank you very much. The medical tourism is about attracting patients from all over the world to a place where we can provide all services for those patients. And this is in alignment with توجيهات صاحب السمو Sheikh Mohammed bin Rashid about having Dubai as the hub for the world-class medicine. This is why actually hospitals are building more and more services and attracting more and more physicians to be able to provide those services. Clemenceau Medical Center is a new hospital here in Dubai. Our presence here is not صدفة. It's really well studied because we wanted to be partners also in this growth and in attracting medical tourism to this city. Dubai's location, whether geographic, whether it's demographics, is very important to attract this type of patients because we have the infrastructure here. So the a very important element of this infrastructure is hospitals. And if we have airlines, we have travel agencies, we have all other infrastructures, very important to bring the hospitals to a level and to a standard in order to meet the needs of those people coming for medical tourism. And also you need availability and accessibility. Because if you don't have enough space and enough places for those people, you might be facing increase in cost, which you don't want for people to attract more and more patients coming from abroad. So basically, the way we do it at CMC is to recruit really very important names and surgeons, physicians from all over the world, is to affiliate with very important institutions, and we have in April affiliated with Johns Hopkins International to drive more physicians from across the seas to come here in Dubai and treat patients in Dubai who are in need for those type of treatments. Of course, this will avoid people going long distances to travel to the States. So this also positions Dubai as a leader in medical tourism. Also at CMC, we are working a lot to implement the technology, to have robotic surgeries, to have surgeries that are not done in the JCC region, and to be able to attract the patients in need for those surgeries. For people with disabilities, we can provide all type of treatments, whether it is functional disability or mental disability. We do have the experts to treat those. And of course, we are now embarking into the training of students and physicians in order to have a more comprehensive programs and give the patient the best. The last thing that I want to stress on is when we talk about world-class healthcare, it's about smart hospitals, and this is what we aim at Clemenceau Medical Center to be. And also is about implementing the latest standards and the best practices, international practices from over the globe. And this is what we do. We were accredited by JCI only 1 year after the opening, which is also an achievement. And I think this goes in alignment with the government wish in order to have world-class healthcare in Dubai.
Thank you, Dr. Rola, for this great information. We have a unique medical tourism in Dubai, which first of its kind, I believe, in the Middle East. Mr. Agab, he's specialized in autism, and he's from Sanad village. This is the only place in the Middle East can offer medical for kids with autism, while their families, they are enjoying their time. The kids, they continue their medical issues. Can you brief us, Agab, please?
Yes, thank you very much. We are a Sanad village. We are the biggest center in the region. We are providing different services for autism. In 2020, there is a recommendation from the first conference about for autism. There is no services provided for adult autism. So in Sanad village, we take that as an initiative to make 48 rooms specialized for autism, for adult and pediatric, to provide a wide and comprehensive services for autism. So we have a short-term residential program which can help the student to be more independent toward in the community. And after like 1 year, we receive a lot of inquiry and from the parent that, for example, they need to come to Dubai to enjoy in Dubai, but at the same time they want to continue the treatment for their child. So we build also sustainable homes, which is like 51 rooms, can be providing the services also for anyone want to continue the service for their child. And our place, like we are in sustainable city in Dubai, which is like give us another option to include the people of determination in the society by providing with different type of experience.
Thank you, Agab, for this brief. Come back to Mr. Mohamed. Can you give us some details about the figures? How many patients? What is the volume of the market? I believe over 1 billion dirham per year. Can you give us some details about medical tourism in Dubai, please?
So it's a bit lower than a billion. It's
Yeah.
around 730 million dirhams. When it comes to number, last year, after the recovery from the pandemic, we were able to achieve 630,000 in the year 2021. And I do believe one of the things that have assisted us reaching those numbers is hosting Expo 2020 in Dubai.
Can you brief us about what is the vision for the coming 5 years? What is the plan?
Well, I do believe that the concept of Dubai around the world is expensive, luxury, and being able to provide services at a normal range and having that range of services that can be provided throughout the whole destination is one of our key objectives to do that. And I do believe that within the current period that we are going through, there are too many initiatives that are provided to ensure that we're creating a better life for everyone, whether it's, for example, one of the initiatives of His Highness Sheikh Mohammed bin Rashid is the Golden Visa. It allows us to host talents, to host people that are or can change the actual infrastructure of the destination.
There is any figures, and not just in the 5 years, like the number of people want to come to Dubai for medical tourism?
Well, we haven't identified that number yet, but what we can look at is the wellness part of it. Previously, we used to promote medical, but we do believe that being in a peace of mind and having that relaxation and being well is defined in a totally different way. Like each and every person in the world conceives wellness as a thing that makes them feel better. It doesn't matter whether it's staying at a hotel for one night, just having a peace of mind and not having anyone surround you at that point of time, or having a certain treatment or an exercise that would allow you to come to that wellness place that you are in. Dubai, with the initiative of 30 by 30 by the Crown Prince of Dubai, His Highness Sheikh Hamdan bin Mohamed, is another activation program that would allow us to understand how does wellness affect our lives on a daily basis. And that is part of the promotions that we're planning to target throughout the coming 5 years as well.
Thank you, Mohamed. Dr. Rola, which kind of support you offer for people who would love to have medical services in Dubai? And can you highlight the nationalities of the people come from abroad just for medication?
Yes, so most of the people, the highest percentage of people acquiring health services here in Dubai is Asian population, and then immediately afterwards it's the people from the Gulf GCC countries. At CMC, we see lots of people from the GCC countries. We are in good collaboration with Kuwait, with Bahrain, with Oman. And they are sending patients to us to treat those. We have recently been listed on the Dubai Health Experience website created by DHA for the hospital who can provide the comprehensive care for those patients. And of course, at CMC, we care for people, and it's a people-centered environment. So it's not only the patient, it's his family. So we follow the patient in his journey from since he contacts us until his after discharge, where we can also follow him up by telehealth consultations and visits at his hotel. So we ensure that the whole journey is smooth and that he receives the correct treatment at the correct time, while supporting him from all other aspects.
Yeah, about the facilities is being offered to the hospitals by DHA, how you evaluate it, and in terms of visa, Mr. Mohammed mentioned the golden visas. It's support.
Yeah, of course. This is a very important initiative. Now the Golden Visa is we are able to attract physicians, high caliber physicians who are willing to stay. This is also a retention strategy to have those physicians staying in the country. And also regarding the visas for the patients who are coming, we have no issues at all. The government is very supportive with this.
I think most of the patients should stay in Dubai after their treatment.
Yes, because it is a very attractive touristic hub.
Yeah, thank you. Mr. Agab, can you brief us more about the details? Because you mentioned you have 50 rooms for. Can you give me more details about it? And how many is the occupancy till now?
Yeah. In Sanad, we can serve up to 700. The idea of 51 rooms is come when Expo is come. Like, for example, we receive many inquiry about we want to be attending Expo, but we don't want to stop the services for our child. So do you have this service? So from this part, we decide to do the 51 rooms, which is like a homes, on daily basis. So we created and we follow a Dubai code, which is accessible for a different type of disability. And also this one, I think we received around 31. So the idea of medical tourism also it's helped the other organization and association. Like in this way, we increase the number of people coming to Dubai. So it will help at another, for example, Expo or trading or economy.
Yeah, we're talking about saving life. Because of that, I think Mr. Mohammed will be last question to each one of you. Life is important, and I believe that Dubai offers the best of the best in terms of medical tourism. Can you give me like a final how you can see this field in the coming years, inshallah?
So
what's make Dubai unique compared with other cities?
So the uniqueness of the destination comes with either the geographical location, the hospitality that we have, and the flexibility of the government in which we adapt to the latest policies that are required to ensure patient safety. Now, that is one part of the equation. The city by itself is a welcoming city where each and every individual that visits would like to possibly have a life over here. Obviously, the most important thing in our lives is our life. So health, in that sense, is the most important thing. And to cater to that, you need quality healthcare. You need quality talents. You need the latest technologies. Today, we are in a different world where previously, for example, telemedicine or telehealth isn't conceived in the proper way. If anyone over here have tried doctor for every citizen, would understand how easy it is for you to reach to a doctor, consult him, and get your medication, and proceed with your life. Similarly, when it comes to medical tourism, I do believe that teleconsultation is one of the main tools that would allow us to save time for the patient, to save money, and to ensure his safety, which is the most important in this case.
Thank you, Mr. Mohammed. Dr. Rola, can you brief me about the journey if a person with disability want to come to do operation in your hospital, starting from his home till here? This cooperation between you and the patient and government bodies here, how it's effective?
Yeah, in the hospital we have an office, which is the international office, which is responsible to deal with the patient from A to Z. So since the patient or his family contacts CMC, there will be an assigned person who will follow his journey step by step, putting a consultation with the physician. This can be teleconsultation, or it can be a face-to-face consultation. Scheduling the consultation, scheduling the flight if the patient is to come here, assisting with the visa, assisting with the transportation from the airport to the hotel, following about the reservations in the hotel, admitting the patient to the hospital. Of course, through the regular processes of our patients, all our patients, which are really the highest, follows the highest standards on quality and safety, to performing the procedure, surgery, if surgery is needed, until the post-op recovery and discharge from the hospital, where there will be also a team following up the patient if he goes back to his hotel, if he wants to stay with his family. This team will go visit and make sure everything is okay, until discharge from the country, where we will also maintain like regular follow-ups afterwards. And of course, there will be the summary will be provided to the patient immediately before his discharge. So wherever he goes, everyone would know what procedure he performed in the hospital. And this is very important for the continuity of the care.
Thank you, Dr. Rola. Last question for Mr. Agab. Kids with autism, they need a special requirement. What is the requirement you think should be offered to them when they come to Sanad Village?
Usually when, like for example, when you are receiving a patient from different country, let us say Kuwait or Saudi, we are arranging with the airline to inform the parent, like we do online consultation with them, which equipment or tools they need to do it, like sensory, to have the self-regulation for the child. And also we are providing with them with a quick training, so they can understand like also like what to do in the airline, how to wait in the airport. So we are providing with the parent with this training from the beginning. And the other thing, like we have some initiative, it will be happening about with the RTA and with the others about the taxi, which is specialized for autism. How to modify the taxi for the autism, like to add some sensory input to have the more self-regulation for the child. So it's like a program, but you know, it's like it's what is called custom made for each one. So every child is different than the others. So everyone have a different, like we can add more step or reduce the step based on the situation of the child.
Thank you very much. We reach the end of our session. Thank you. I have specialized in their field. Thank you very much, Mohamed, Dr. Rola, Agab, and we assure you that, inshallah, Dubai, it will offer the best of the best in terms of medical tourism. Thank you very much. Thank you.
Thank you.
Thank you very much. Thank you.